Breaking news for Social Security and SSDI recipients across America. Congress has just approved a groundbreaking $5,800 lifetime support fund set to begin disbursement on March 1st, 2025. However, there's a catch. It will initially roll out in only 25 states. If you're wondering whether you qualify and how to claim your share of this life-changing support, which could provide up to $483 monthly in additional assistance, stay tuned, because I'm about to reveal everything you need to know about this revolutionary program that's transforming lives nationwide. The financial landscape for Social Security beneficiaries has been particularly challenging throughout 2024, with inflation rates impacting fixed incomes and essential costs continuing to rise. Today, I'm bringing you detailed information about a significant development that could offer substantial relief to millions of Americans. This new support fund isn't just another temporary measure. It's a lifetime benefit that could make a real difference in your financial security. With the first payments scheduled to reach eligible recipients by spring 2025, let's delve into what this $5,800 lifetime support fund truly means for Social Security and SSDI recipients. This initiative, approved in the latest congressional session with bipartisan support, represents one of the most significant expansions of support for beneficiaries in the last decade. The program has been meticulously designed to address the growing financial challenges faced by recipients in our current economic climate, with implementation set to begin in the first quarter of 2025. Unlike previous assistance measures, this program is not a one-time payment like the stimulus check seen during the pandemic. Instead, it's structured as a lifetime support fund, allowing eligible recipients to access these funds throughout their benefit period. Recipients can choose to receive the support in monthly installments of up to $483, quarterly distributions of $1,450, or customize their disbursement schedule based on their specific needs and financial planning goals. What makes this program particularly unique is its targeted approach to supporting those who need it most. The $5,800 allocation isn't arbitrary. It is based on comprehensive research conducted throughout 2024, analyzing the additional expenses that Social Security and SSDI recipients typically face beyond their regular benefits. This includes considerations for healthcare costs, which have risen by an average of 6.8% in the past year, housing expenses that have increased by 4.2%, and essential daily needs that continue to stretch fixed incomes to their limits. The 25-state rollout strategy, scheduled to begin on March 1, 2025, has been implemented to ensure proper administration and smooth distribution of funds. The initial phase includes states with the highest concentration of eligible recipients, such as Florida, Texas, California, New York, Pennsylvania, Ohio, Illinois, Michigan, North Carolina, Georgia, Arizona, New Jersey, Virginia, Washington, Massachusetts, Tennessee, Indiana, Missouri, Wisconsin, Maryland, Minnesota, Colorado, Alabama, South Carolina, and Louisiana. This phased approach allows program administrators to fine-tune the distribution process and address any potential issues before the planned nationwide expansion in early 2026. For those wondering about the specific timing, the application portal is scheduled to open on January 15, 2025, allowing potential recipients 6 weeks to submit their applications before the first disbursement date. Early applications submitted between January 15th and February 1st, 2025, will be prioritized for the March 1st payment cycle, while later applications will be processed for subsequent monthly distribution dates. The eligibility requirements have been carefully structured to ensure the support reaches those who need it most. The primary qualification starts with current enrollment in either Social Security Retirement Benefits or SSDI as of December 31, 2024. However, there are additional criteria that need to be met, including income thresholds based on household size: $32,000 for single recipients, $48,000 for couples, and additional allowances of $8,000 per dependent for Social Security retirement beneficiaries. The program takes into account your current benefit amount and any additional income sources, including investment income, pension payments, and part-time work earnings. Those receiving less than $2,000 monthly in combined benefits and additional income will receive the maximum support amount, while those earning between $2,000 and the income cap will receive proportionally adjusted amounts. SSDI recipients face slightly different criteria, considering factors such as disability severity, current benefit amount, and additional household income. The program recognizes that disability-related expenses often create additional financial burdens, which is reflected in the eligibility requirements. SSDI recipients with documented medical expenses exceeding 15% of their annual income may qualify for supplemental support of up to $750 per quarter. The fund usage guidelines offer considerable flexibility while ensuring responsible utilization. Approved expenses include medical costs not covered by Medicare or other insurance, housing-related expenses, including repairs and modifications, utility bills, and essential daily living expenses. Starting in April 2025, the program will also introduce a special allocation for preventive health care services, allowing up to $1,200 annually for wellness visits, preventive screenings, and dental care not covered by traditional Medicare. The application process has been streamlined for accessibility, though it requires careful attention to detail. Recipients will need to submit documentation proving their current benefit status, income levels, and residency in one of the participating 25 states. This can be done through the Social Security Administration's online portal, which will be updated with a dedicated section for this program by January 15, 2025, or through local Social Security offices. Assistance with applications will be available through designated support centers in each participating state. The program includes a robust emergency access provision, allowing recipients to request expedited fund releases in critical situations. Emergency requests can be processed within 48 to 72 hours, compared to the standard 2 to 3 week processing time for regular applications. This emergency access feature will be particularly valuable for unexpected medical expenses or essential home repairs that might otherwise create significant financial hardship. For those in states not included in the initial rollout, the program's expansion timeline has been carefully planned. The second phase of implementation is scheduled for January 2026, adding another 15 states to the program, with the remaining states to be incorporated by July 2026, achieving nationwide coverage within 18 months of the initial launch. The program also includes innovative features for fund management and long-term planning. Recipients will have access to a dedicated online portal where they can track their fund usage, plan future expenses, and access financial planning resources. Starting in June 2025, the program will introduce a mobile app, making it even easier for beneficiaries to manage their support fund and submit expense documentation. An important aspect of the program is its cost of living adjustment COLA provision. The initial $5,800 allocation will be reviewed annually, with the first adjustment scheduled for January 2026. These adjustments will be based on the Consumer Price Index for the elderly (CPI), ensuring that the support remains meaningful as living costs change over time. The program has also established partnerships with major healthcare providers and pharmacy chains to offer additional discounts to fund recipients. Starting in May 2025, participants will receive a program card that provides additional savings of 10 to 15% on prescription medications not covered by Medicare and 5 to 20% discounts on eligible medical supplies and over-the-counter medications. For multi-generational households, the program offers special considerations. Families where both elderly parents and disabled adult children receive benefits may qualify for enhanced support, with potential combined household benefits of up to $8,700 annually. These enhanced benefits will be available starting in September 2025, following a program review and adjustment period. The financial counseling component of the program will launch in April 2025, offering recipients access to certified financial advisors who can help develop personalized plans for fund utilization. These services will be provided at no additional cost and will include quarterly review sessions to help recipients maximize the benefit of their support fund. Looking toward future developments, the program includes provisions for potential expansion of covered expenses. A review panel will meet quarterly to evaluate additional needs and may approve new categories of eligible expenses based on recipient feedback and changing economic conditions. The first such review is scheduled for June 2025, with any approved changes implemented by October 2025. For recipients concerned about tax implications, the program has been structured with tax efficiency in mind. The support fund distributions will be classified as non-taxable benefits at the federal level, similar to certain Medicare advantages. State-level tax treatment may vary, but program administrators are working with state authorities to secure favorable tax treatment across all participating jurisdictions. The program also includes a unique feature tailored for seniors who wish to age in place. Starting in August 2025, recipients can allocate up to 30% of their annual fund toward home modifications that improve safety and accessibility. This includes installations of grab bars, wheelchair ramps, and other essential mobility modifications. Now that you understand what this $5,800 lifetime support fund offers and the important dates to remember, it's crucial to take action if you think you might be eligible. Don't miss the January 15th, 2025 application opening date. Mark your calendar now. Click the link in the description below to access our comprehensive guide on qualifying and applying for these funds. Make sure to subscribe to our channel and hit the notification bell to stay updated on any changes or expansions to this program. We'll be providing weekly updates on application procedures and program developments leading up to the launch date. If you found this information helpful, give this video a thumbs up and share it with anyone you know who might benefit from this support fund. Remember, knowledge is power, and sharing this information could help someone access the financial support they need. This program is designed to provide real, lasting support for those who need it most, with the first payments starting March 1st, 2025. Now is the time to prepare your documentation and understand your eligibility. Don't wait to find out if you qualify. Take the first step today by checking your eligibility and gathering the necessary documents. Thank you for watching, and I'll see you in the next video with more important updates on Social Security and SSDI benefits.